yes.
Yeah.
But it's not in everybody. And Carl, having a great deal more experience in medically working with indigenous people, how common is cancer in indigenous people compared to those in the rest of the world? Because that's such a common disease in outside. The two big killers, so to speak, cancer and heart disease, which seem to be diseases of affluence and, quote, civilization, as far as I can tell, more than indigenous. That's my impression. Is that true?
Yes and no. We didn't see much cancer and heart disease, but the average lifespan among indigenous people 50 years ago was about 44 years of age.
Okay.
So then part of the manifestation of cancer and heart disease is an age-related phenomenon. And of course diets changed and lifestyles changed. So for most indigenous people, a way of life was acutely psychohistorically disconnected, so that the warrior tribes were defeated. They could no longer wander and hunt. They had to be agrarian. They had to change their entire lifestyle. Whenever somebody comes and tells you you have to change your life as a ticket for survival in the culture, it's predicated on some inequality. It emphasizes their power in having you change and you having to go along with the program. So that takes its own psychic toll. So people get depressed and they feel miserable, and all of these issues become related. Diets change. Diabetes was virtually unknown among native populations. It was non-existent 50 years ago. We changed their diets, and now most of the tribe is afflicted. There may be a genetic proclivity, but as you change the lifestyle, as you change the culture, then you begin to mirror the symptomatic manifestations that other cultures also have. And of course, people are living longer, so they're now getting those diseases as well.
You know, if I may introduce some thoughts here to, it's very common now to think about how the Native American people have been cut off from their traditions and cut off from their land, and to look at the consequence of that within their psychic field. But let me postulate that the other cultures have been cut off from their land and their traditions in different ways, but equally traumatic ways. And that there is a tendency to swing in an opposite direction so sympathetically, like to look at allopathic medicine from one way and then to look at Eastern medicine as if everything about Eastern medicine is so correct and so on target that it is not flawed, and everything about Western medicine is flawed, and that is completely naive. I'm sorry, but I will not take that position at all or support it. I think that the people in the West have an equally, the people who are not Native American, who come from different traditions, have been equally traumatized in their own way by being cut off from traditions that are deeply rooted within the need to have cultures and extended tribes of their own. Tribes in extended cultural family that have been completely broken up by the shattering of, for example, long-term marriages, where it is abnormal for people to take on 2, 3, 5 mates in a lifetime, and to break up families, and that is breaking up their equivalent of tribal commitment to the land. It is abnormal for children to have 14 and 15 different parental figures. It is an absolute psychic shattering for these children to be raised in that type of environment. It is as shattering for them as it is for the Native American to be withdrawn from their culture. And it is too difficult for me to sit back and listen to the endless trauma of the Native American and not have the trauma of the Western culture and its breakup within the Judeo-Christian fabric of the shattering of that tribal structure be recognized as an equal psychic trauma.
Well, one of the new words for the new medicine that's emerging is integrative medicine, using the best from the East and from the West. And there's something of value in each tradition. And it seems to me the trick is to let them communicate with each other and learn how to use I mean, the problem with the Western mind is we've grown up educated to think science is the God, okay? And that's why I bring up the prayer as an example, because if you can show people that there's research that backs up some of these results of the homeopathic and the alternative medicine approaches, then that can talk to those people who are looking for that kind of reassurance. But it seems to me like the real trick is to get these two together and to find what's the best in each one and how to bring them together.